family therapy in substance abuse treatment. Myself Ashfaq Ahmad and Chairperson Dr. Geetanjali Narayan. So these are the area we are going to focus in this time. It will start out from the introduction and the family, the type of the family, and how the impact of substance abuse is related to the family function. Then the classification and the special will understanding about the various family therapy in the substance abuse treatment and the special population and conclusion. So as an introduction, you can understand that a family is much more important for any type of the treatment modality, if it is mental illness or maybe the physical illness also. So therefore, the substance abuse also is included in that area. And you can see the other area, family is much more involved and ready to support him into the treatment modality, but we will not see that much supportives in the area of substance use treatment. So therefore, for the treatment purpose also need to mainly focusing on the individual based things. So that is the challenges we are facing in this point of the time. We need to go from the individual to the family area. For example, you can see as a psychologist or counselor is taking the counseling or therapy, usually focusing on the individual goals and target. And we usually neglect what is the viewpoint this belongs from the family area. So that is also very important to making the goal setting in the individual. So you can understand what is mean by the family. Family is a part of the society. It is a small organized structure. It's a group. It is a part of our society. In the definition manner, you can see it's a two or more person who are related by blood, marriage or adoption, and who live together as one of the household. And apart from it's very important that when there is an emotional level of the bond is remaining in between the family. Thing. So for example, you can see one of the family member is leaving the America, but still they are maintaining an emotional contact with the members and they are maintaining that relationship. Now it's coming to the type of the family. You can see there is mainly three type of the family settings. You can see the one is the traditional family. It is made by the biological relationship or the single parent, or some of the children was adopted by the other family member, or grandparents was taken the grandchildren, or that manner. In this extended family, apart from one couple, more than one couple is staying in the same household, where maybe they are relatives or maybe the distant relatives. An elected family is much more recent scenarios coming to our environment, where because of the particular topic or particular interest, they are living together and they are maintaining their emotional bonding. And you can see, for example, in the religious manner also, you can see maybe the special population like the lesbian category, gay category also, they are staying together and they are remaining with as a family. And another very point is, so therefore, based on this background, that is very important that one we need to come to the family therapy. It is not exactly decided by any client or the therapist. Usually, you can ask some of the question to the family member like, who is important to you? And what do you consider your family to be? So to understanding, to asking this question, to getting the result, through that maybe you can take the person who is going to be in the family therapy. Now, this is a point where how the substance use impact in the family function. It actually in a reciprocal relationship, you can see. One side, the family factor, including the parental psychopathology, maybe the mental illness or family conflict, relationship distance and parenting deficit are all strong predicting for the drug use initiation or maybe the maintaining with the substance use. And the same manner, you can see high level of the, on the other side, you can see that one high level of the supportive parenting, reducing the genetic vulnerability for the substance use increase over time. So it is also changing the biology of our persons. Also, you can see that when the family conflict, low family support, drug use among the other family members and the parenting trust can also contributing to relapse after the drug treatment. So one person is taking the treatment and coming back to the same situation where the family have the much more role. And the drug abuse negatively affected the parent and children through the intimate partner violence. So here we can see some of the different situations. What are the consequences can happen to the the person who is staying along with the person who is taking the substance use. So one is the first condition is the client living alone or with the partner. So here you can see much more economical or psychological consequences you can see. For example, the client is spending much more money for taking the alcohol and is asking the money from the partner. So that is can lead to the economical or financial burden to the family settings. Along that one, maybe the denial, not giving much more emotional support, anxiety, distress, withdrawal symptoms of substance use can also lead to a psychological consequence of the partner, to the partner. So second case, you can see the partner, second situation is the client living with the spouse or partner and the minor children. So here some of the cognitive, behavioral, psychosocial and emotional consequences for the children can happen, which including their impairment learning capacity, or maybe that propagate to take the substance use in that person also, and can also lead to the adjustmental problem for him, which can also lead to the depression, anxiety or low self-esteem. The third situation, the client is a part of a blended family. So one of another family member is marrying to the added to this family. So because of that lacking of emotional contact, which can lead to unique issues where the parent authority dispute, sexual or physical abuse or self-esteem problem for the children can also happen. So because of that thing also, it can increase the social, emotional and behavioral problems. The fourth condition is the oldest client have the grown children. So here you can see the grown children can take the parenting role, rather than old client is taking the parenting role in the family settings. So the old client may be difficult to adjust with this reversible role of the parenting. He might be get much more restriction to get the financial from the children, which can also lead to much more stressful, painful and embarrassing situation. Now, why this type of the consequences is happening? Because of to giving to the formulation for that one, Rayleigh has given found some of the characteristic pattern which can happen, mainly telling about the interaction between the client who's taking the substance use and other family member. So one of the character you can see in this the family dynamics is the negativism. So here communication that occur and when the family member is negative or talking the form of the complaints, criticism and other expression of the displeasure can happen to the settings. Next is the parental inconsistency. So here they have the difficulty to make a rule which is maintaining in a consistent manner. So the children have the difficulty to understand where is the boundary of the wrong and right. So he will be much more confused, and that some of the time can also lead to a bad reaction because of to understanding the clear boundary from the right and wrong. Or maybe he will become the badly react to the family member and telling that one point of the time you are reacting that man, another point you are reacting another point. So what is exactly we need to follow? So this can also lead. And third is the parental denial. Here, despite of any harmful sign, the parents or the person may be minimize his problem. He is not understanding it's a problem for me. Substance use is a problem for me. Or otherwise, he deny for his children problematic substance use. Next is the miscarried expression of the anger. Here, it does not have the platform to show is the emotional. So here we have the emotional deprivation in the family settings, which can also lead to use of the substance use, and showing that one is showing to is represent anger. Next is the self-medication. Here the parent or child will use the drug or alcohol to cope up with the intolerance thought or feeling such as severe anxiety or depression. Next is the unrealistic parental expectation, where the parents are giving much more unrealistic goal to the family member, and the children are repeatedly trying to get that one, and he was not able to reach that one, which is giving a discord in the family situation. So it's lead to distress in this family context. And maybe he will answer to like, you cannot expect anything of me, I am just a jinky. So this type of the comments or you can expect in this. So it is also very important to initially looking to do the assessment in the family context. So we can follow a step-by-step procedure. Initially, we'll gather the identifying the data and establishing a current phase of the family life cycle, and what is the scenario is happening, what is the thing is going on the family dynamics. We can take that points from the family members. And along with that one, we are gathering explicit interview where we are understanding what is exactly the problem, what exactly they are seeking help from our side. So along that one, the reason we looking to the recent family event and the distress which leading to this situation. So we are looking to the what is the background for this family problem, what is the history of the past treatment attempt or other attempt at the problem solving in the family, what other the problem has the family had, and what are the family's goal and expectation for the treatment. So based on that one, we can understand what is the strength we are seeing in these family settings, what are the motivation is there to getting the treatment, and what is the challenges we can see in the point of intervention. So based on that one, we can formulate the family problems area and rating important dimension, which also we need to focus about the communication pattern in these family settings and how they are understanding the problem, what are the strategies they are using the problem solving, and affective responsiveness and involvement, and how much the control or behavioral control restriction is happening in the dynamics, and operating family beliefs and stories based on the morality religious happening. And based on that one, we can reach a diagnosis, and it's helping to us to make a family intervention. That is the family therapy. So family therapy, the definition manner we can see is an intervention that viewed the family as the unit of the treatment. It's not an individual man. It's not, rather than it's an individualized, it's a unit of the treatment, and where the more than one member of the family was seen either individually or conjointly during the course of therapy. So the family therapy in substance use treatment have the two purposes. One purpose is family strengthen and resource to help find to or develop way to live without the substance of use. So despite of the substance use, how they can maintain their family relationship. And second target is getting better the impact of the what are the chemical dependencies happen because of the chemical dependency happen on the both of the client and the family. Now, you can might have heard about the family involvement therapy, and that is different from the family therapy. The family involvement therapy usually is the psychoeducating to teach the family about the substance abuse related behavior and the behavioral, medical, and psychological consequence of use. But in the family, it's a one-way method. In the family involvement, much more in a one-way method, we are giving much more educating regarding the substance use. But in the family therapy, is a systemic and it's a two-way process. In the therapeutic grouping is making, and intervention is a system of the family relationship. So I'm giving a brief idea about the major classification. This is given by Alan Carey, and it's based on the three parameters. One is the problem maintaining behavior, the pattern, and problem maintaining belief system and narrative, and predisposing historical, contextual, and constitutional factor. And you can see the different type of the family therapy is available, but I'm just skipping and because of the time constraint. And coming to the what is the major predominant family therapy model in the context of substance use disorder, we can mainly see the 4-1 family disease model, family system model, cognitive behavioral approach, and multidimensional approach. In the family disease model, the substance abuse is considered as a disease, and they are also understanding it can affect the entire family. So the family member of the people who abuse substance may be develop a codependency which causes them to enable the client's substance use. So who is taking the substance that can also influence the other family member, and because of the attraction may be another factor, and whenever it is become a dependent the whole family, this can lead to an enabling environment where nobody is understanding it is a problem for their family settings. So limited control research evidence of available the support the disease model, but the influence in the treatment community as well as in the great public is there. Now, second is the family system model, where basically they're telling the substance use is taken because of the dysfunction is happening in the family settings. So the family setting is not narrowed down like the two couples is the or it can be extended family can also, that extended family dysfunction can also lead to the substance use, or maybe that dysfunction is happening in the school setting or other workplace. It's called the multiple system can also lead to the influence of the substance use. So here, why he is taking the substance use, he want to maintain this stability in their organization. So for adapting that one, he need to have the substance use. So what the family therapist has needed, for example, we can see a man with the substance use disorder may be antagonist or unable to express his feeling in the family settings. So unless he is intoxicated, so he need to take the alcohol, then only he can express his feeling in the organization. So using the system approach, a therapist would like for an attempt to change the maladaptive pattern of communication, so rectifying the problem in the organization and the family role structure. So he does not require any substance use to stabilize in the organization. So what is this technique we usually using in here? So we are using the circular notion of the causality representing the communication pattern and the problem, and behavior of one member impacting another and vice versa. So we need to focusing on that one. It should not be influenced. And therapists to do look at the linear recurrence of the addiction. What is the reason to relapse and continue taking the addiction? And one even sees as modifying another, which is seen as a modifying the first. And toxicity of the causes of the blame taken out of the conversation regarding the addiction and the related the concern. And therapist's role is to be uncover dysfunction pattern of the communication which is happening in the family settings. And very important is rectifying the triangulation. It's a triangulation where the both of the couple have the problem and they do not want to disclose about that problem. So what they will do, they will project on the third person and projecting is understanding the problem of other person and digging off that problem and coming into the family settings. And they're considering this is a problem rather than their own problem. So we need to this family process. Evidence basically showing one of the studies done by Walzer, and he has compared the behavioral marital therapy and family system therapy, and he saw that when the family, if the problem involved a whole family organized around the alcohol or illicit drug, family system therapy could be a superior strategy compared to other. This we can come into the cognitive behavior approach here based on the idea that maladaptive behavior including the substance use and the abuse are reinforced through the family interaction. So the behavioral oriented treatment try to change the interaction and target behavior that trigger the substance abuse or improve the communication and problem solving and strengthen coping skill. So here you can see what are the major strategy we usually use here. We make a community reinforcement training interviews to the group manner and understanding about the problem, and we are teaching about the problems solving strategy and employing the structural and strategical viewpoint. Maybe is the belief system maybe is leading to the problem in the family setting, so we need to have the strategy for that one. And using communication skill as a healthy communication skill, it should be direct communication rather than giving to indirect whenever he has the need. And he need the family also need understand getting the skill of the negotiation skill and employ a conflict resolution technique and use the contingency contract where he will be get rewarded based on his desirable behavior and he will be avoided his desirable reward when he was doing undesirable activity. Next is the multidimensional approach. Here they are mainly focusing about the emphasis on the relationship among the cognition, affect, especially emotion, behavior, and environment input. So it is an integrated program, right, including the multidimensional family therapy, functional family therapy, and multisystemic therapy. Anyway, we are coming to that in more detail. So we have one guideline where we are mentioning about which is the much more effective family therapy in particular illness. So it is given by National Institute of Health and Care Excellence. So in alcohol dependence and harmful alcohol use, especially the children and young people, the following family therapy, special family therapy will be much more effective. That is including the brief strategic family therapy, functional family therapy, multi-systemic therapy, and multidimensional family therapy. In the case of the adult, is which more effective is the behavioral couple therapy and couples therapy. In other drug misuse, the behavioral couples therapy, behavioral family intervention, and social system intervention. So it is based on the meta-analysis study. They are understanding which is, these are the special family therapy is much more effective in this type of the illness. So coming to the behavioral family therapy, earlier I also mentioned about that one. Here we are reinforcing the behavior and attitude conducive to the drug abuse and attempt to alter these contingencies so that the family can help the promote the individual abstinence. So here the multiple relatives can help him to come out from this substance use disorder, and he will be rewarded according to that his the behavior. In the behavioral couple therapy, here you can change, like in the initial stage, therapist made a commitment with the client for the sobriety. And this sobriety should be reinforced by the couple in a daily basis. And he also need to discuss about the strategy to help the drug abuse cope up with the craving and for the couple to deal with the crisis concerning the relapse. So here the couple, spouse and partner have much more role to understanding about his commitment of the sobriety and understanding about the craving. So he or she can express the share and discuss with the partner, and they can also think about the strategy to cope up in a healthy manner. So, and communicate more effectively and increase enjoyable activities. Where the spouse or partner have much more role to continue the alternative enjoyable activities, so therefore they can abstain from the substance use. So here there is a meta-analysis also compared with behavioral couple therapy along with the individual comparison treatment, and they recognized that one average medium effect was saw in the behavioral couple therapy, and was much more follow-up is happening, and abstinence period is also happening because of the behavioral couple therapy compared to the individual therapy. Then we can come to the brief strategic family therapy. So it is prevent and treat the child and adolescents the problem behavior. It is a short-term intervention that focus on the identifying the problem and then finding way to the change those the behavior. Where we have the 3 to 4 month period, averaging of 12 to 16 section, which can be leads to 60 to 90 minutes of session. And here is a intervention designed to prevent and the treating child and adolescent problem behavior. And the program uses this restructuring and reframing the technique to help the family as a whole reduce the problematic pattern and to teach them how to develop a communication, parenting, and to conflict resolution skill. Especially the problematic behavior adolescent child, we need to have the look into the parenting style and how you can go to the crisis management, how you can maintaining a good communication, where will be problem will be rest, rather than giving much more the criticism manner. So one of the study by Sadista Ben and colleague, he also mentioned about the reduction in the behavioral problem and the reduction in some drug use behavior and increasing the family function because of the brief strategic family therapy. So coming to the functional family therapy, it usually much more effective the youth age 11 to 18 years and successfully tested in a multi-ethnic and multicultural context to treat the youth and their families. So here the treatment aimed to change negative family interaction and use the behavioral intervention to reinforce the positive way of responding and more effective the problem solving approach within the family. So you can also understand what is the difference between the earlier family therapy and here. And especially youth diagnosis with the conduct disorder, oppositional deficit disorder, and disruptive behavioral disorder, it is much more effectively useful. One of the studies is Sexton and Tuner in 2010, and they have looking to the functional family therapy and the outcome. So they have the outcome they have showed that one the significant reduction in their serious crime, and also they have get the result is significant reduction in the violent crime recidivism, means habitual repetition of the crime for the delinquent youth. In multidimensional family therapy also is much more effective, much more research is happening in that area, especially the substance use disorder, especially the studies much more happen in the Lidley. And it is an integrated outpatient treatment, blending family therapy and individual therapy, drug counseling, and multiple system-oriented intervention is also included. So it's a multi-intervention is included in the area, and it is working in the 4 domains. One is the targeting change in the adolescent, especially is interpersonal and the relationship developmental issue, which is happening in the family setting, and working with the parents, so individual functioning of the parent and the parenting style, and looking to that one. And what is the family environment and how the family transition, how it is leading to the problem in that settings, and extra familiar system of influence on the adolescents and family, example maybe the working with the school and juvenile justice system. And research also showing that one, especially the cannabis youth treatment, multidimensional family therapy is one of the promising family therapy. And youth and family function in a range of domains have been shown to improve during multidimensional family therapy, while comparing to manualized computer cognitive behavioral therapy based group peer group treatment, and to maintaining gain the following the treatment. So it is comparing with manualized cognitive behavioral therapy, and they understand that one, the functional in the youth, the client, and the family setting much more improved. So in the multidimensional family therapy, some of the strategy we use is, initially we are stabilizing the family. Is there any violence? Is there any security problem, violence, or some of the issue is happening? We need to make a contract to stabilize this problem in the family settings. And then the reorganizing the family, like maybe the child has taken the parenting role and is controlling, and parents are following what are the instructions getting. So we are reorganizing the family settings and teaching the relapse prevention of family member, and identify the communication dysfunction is happening in the family settings, and teaching the communication and conflict resolution skill to them, and assess the developmental stages of each person in the family. So assess developmental stages to the problem and developmental stages to the benefit, and consider the family's system interaction based on the personality disorder, and consider whether to be medicated for the for depression, anxiety, or post-traumatic stress disorder, and consider whether to address loss or mourning, means grief or anything, along with the sexual or the physical abuse. Coming to the multi-systemic therapy, it is also much more effective one. In social, it is based on the social ecological approach to altering the multiple risk factors that creating and maintaining adolescent drug use and delinquency, that is widely recognized as among the most effective approach for reducing the juvenile delinquency. So here is the goal is restructuring of the youth environment to reduce the antisocial behavior. So multisystemic therapy work actively and intensively in both the home and community to the empowering the parent. So you can see the difference between the each family therapy and based on the target and the issue. Now it's coming to the special population. You can see the adolescents. Even I also mentioned about various type of the family therapy, and research also indicating that one of the examples, the Becker and Curry, is a review revealed that multidimensional family therapy and multisystemic therapy had a superior treatment effects in adolescents drug treatment studies compared to the other one. So it is categorized as a superior treatment effect. Meta-analysis by Waldron and Tuner are reported by multi-dimensional family therapy and functional family therapy and cognitive behavioral therapy as well established the family therapy for the adolescents drug treatment. Austin and colleagues also categorize the multi-dimensional family therapy and brief strategic family therapy as a probably efficacious for the adolescents drug treatment. Now coming to the old adults, some of the particular old we are usually consider more than 60 years old, and the data is showing that one there is a 17% of older adults are estimated to have problem with the alcohol or prescription drugs. And the problem we can see is that one old age time, the much more control or parenting control was taken by the grown-up child. So that does not have much more independence in the setting. So whenever they are coming for the therapy, we should have give much more autonomy and privacy to the patient, and give much more the freedom to talk about their feeling. And looking to the old age related issue, it does not have much more the scientific evidence family therapy. Coming to women area, again the family therapy for women with substance use disorder is appropriate, except in the case in which there is no ongoing partner abuse. So in the women cases, mainly we need to look into the safety should be always be the primary consideration, because the family setting, the woman is much more vulnerable for the violence. And Cunnington also mentioned about whenever you are doing the family therapy with a woman, you should be change your scenario where you need to focus on the woman's specific need in the initial stage and understanding their daily realities. And Figelston also is mentioning about emphasis on the looking to the same point, but he is also mentioning about you need to look into the holistic approach to achieve the successful outcome in the case of the woman. Then coming to the prisoners, the chaperone described a family therapy approach used to reduce the relapse and parole violation and recidivism of individual released from the prison and jail. So here what they have done, they have made the family intervention which helped them to reduce the criminal activity, and again going back to the jail is 50 to 35%. So, coming to the conclusion, addiction is a major force in the people with substance abuse the problem. People with substance abuse the problem also are residents with the powerful context including the family system. Therefore, in an integrated substance abuse treatment model based on the family therapy, both family function and individual function play important role in the change the process. So again, I'm emphasizing at the point like going into the individual function may not be understanding about the problematic behavior in the family dynamics. So it will be always good practice to collaborate with the family members in your interventions. So analysis of family-based program find that family strengthening initiation have more immediate and direct impact on improving family relationship, support and communication, and on reducing the family conflict. By treating the family as a unit, this program are better able to identify the origin of problem behavior as well as way to change behavior in both children and the family.